Good afternoon. I'm Lorna Rosenberg. As you have heard already, I'm with the US EPA out of the Philadelphia office, and I am here representing the government. And just so you know, we are really worried about your indoor health risk. It's true. How is that? Well, the Clean Air Act sets EPA up to protect your indoor air quality health. And we do that not by thinking about coming into your home or your place of business and monitoring in your space, because I think everyone would agree that would be really undesirable. But we do it by focusing on source control, providing guidance, and providing opportunities to educate the communities about and Americans about healthy indoor air. Some of the laws that are in place that allow us to do this are the Toxic Substance Act, the FIFRA, Rodenticide and Pesticide Act, Pollution Prevention, even Superfund through vapor intrusion that could happen in buildings, Safe Drinking Water Act. You saw already about lead contamination in drinking fountains as a problem, and the Resource Conservation Recovery Act, just to name a few. If we time travel back to 1990, the EPA Science Advisory Board at the time published a reducing risk, setting priorities and strategies for environmental protection. And in doing that, we ranked indoor air quality as among the 5 top environmental risks to public health. So that geared us up even more to focus on indoor air as an opportunity. And we did that, and we do it through research, providing information, and also education. In the realm of research, we do a lot of research through our Office of Research and Development and other EPA offices on materials for source-specific controls. So as you've heard already today, a lot of what we're focusing on in terms of products is trying to keep products safe depending on what goes in them. So we concern ourselves with that. Lead has been banned in products, in paint. PCBs are banned in ballasts. So that has been the work of EPA, and we've done research to prove that those opportunities are necessary. On the very exciting opportunity, we have the STARS grant, which is going to be through our Office of Research and Development, and they'll be coming out and announced shortly that we're going to be working on a project with universities around the country looking at the health impact of school buildings on student and staff health and performance. And if all is well, we will all hear about that very, very shortly. Ooh, it went to the next one. Look at that. Okay, and we create information through guidelines, toolkits, pamphlets, and brochures, and also we educate with the information that we have and the research that we perform through webinars and websites and publications. I'm sure many of you, most of you, all of you are familiar with EPA's work in that area, and we try as the government to lead by example. Okay. Whose health do we worry about? Claire did a really great job of talking about children and why we worry about children. And in EPA's indoor air quality work, a lot of the programs that we have are focused on schools and kids and children's health. We even have an Office of Children's Health Protection as a focal point because, as she said so aptly, kids are not little adults, and we need to worry about them more. They're around on this earth already longer than we are, because we're already here where we are, and they have a longer life to bioaccumulate toxins and heavy metals, and we want to try to keep the next generation safer than the generation before. But other vulnerable population groups are, of course, seniors and who are at risk for nervous system and cardiovascular issues, pneumonia, folks who have already compromised immune systems, and those who have genetic challenges or existing diseases, so we worry about them too. let's see, which one of these, since it magically, oh, the clicker, hold on. Okay, there. Is that right? Okay. So in looking at our indoor air issues, there are 5 areas that there's actually 4 areas, the truth be told, 4 areas that were endpoints that EPA is concerned with. And one we threw in because the last one is one we want to be concerned with more, and that's why we're involved in this conversation. So asthma, cancers, reproductive effects, and development health, which you've already heard about previously to me, poisoning and death, always important to avoid, and the well-being one. The well-being one is really an area, we'll call it as a global topic, well-being, but this idea of performance and the idea of less absenteeism and feeling better in your buildings. In fact, many of us at EPA are concerned about that, even if it doesn't show up exactly. There's some data you've already heard about asthma that CDC will tell us that 1 in 12 people have asthma, and it costs our U.S. government about the government or the U.S. as an economy, I found $56 billion in medical costs, law school and work days, early deaths. So that's really incredibly frightening, and we need to think about asthma as a trigger. And then cancer, of course, asbestos, radon, tobacco smoke are all known human carcinogens, and chlorinated solvents, the polycyclic aromatic hydrocarbons, pesticides are likely cancer causers, and they are often found and used in buildings, and we have to concern ourselves with them. Reproductive and developmental effects, you've already heard about opportunities and where that can be a problem. Poisoning and death, carbon monoxide from fuel-burning appliances, and Legionnaire's disease are things that EPA researches, writes about, and tries to educate. And under the well-being and the things that we were all talking about today, and we'll continue this conversation, that the airflow issues, we write a lot about that, we care a lot about that, good air quality in general in buildings, lighting and toxins, that we want to make sure that those challenges are met, that we at EPA contribute to standards that are set at ASHRAE through building codes that focus on the kind of air quality that will result in increased attendance and increased performance in buildings. Okay, so it turns out also that I found out, much to my excitement, that in 2001 we did publish a document, and I'm not in the indoor air quality group, just so you know. I work on healthy schools mostly, but I've discovered that we did have this great publication called Healthy Buildings, Healthy People, A Vision for the 21st Century. I think somebody else had a 21st century document they reference as well. And the goal of that EPA wrote this and researched and wrote this document that said that major human health gains can happen by upgrading indoor environments. So that set us on a course toward even more work on indoor environments. And this was in 2001. So the vision, the goals that they set for themselves were to improve professional education, that we would participate as EPA in a design revolution to result in buildings that promote better indoor environments, stimulate health in existing buildings, contribute to creative use of innovative products that are healthier, and influence healthy consumer behavior. So I sort of thought about it a lot, since I've had a lot of green building experience as well, and I thought, you know what? I hate to say it, or I'm happy to say it, but it looks like the government really sort of made some progress, and EPA in particular, in all these areas. And I'm happy to I feel quite proud about that. We could always do more. We could always do it better. But at least we certainly are part of the conversation, and we have made these contributions. And then finally, these are just some of the kinds of programs that EPA is engaged with, has promoted, participates in, tries to convene in our work. Some of it is regulated, like asbestos and PCBs. Claire and I have that same caution PCBs up there. Some of it has to do with who we train or who we set standards for, like when you're removing lead paint from a building, you now need a certification to do that. That's the guy in the lower left-hand corner. Energy Star, you're probably all familiar with that. It has obvious benefits beyond just the energy efficiency of a building, but the better operation of a building. Our Smart Growth program, looking at not only what goes on in the building, where the buildings are placed. That was a lot of the conversation, I believe, at the last time we were all together here. Our Sensible Steps to Healthier School Environments gives a school focus, tips, ideas, legislative requirements that schools need to participate in, opportunities there are that increase the health of a school environment. Mold and mildew being a chronic problem in schools and commercial buildings, so we give recommendations on how to clean, how to respond to serious mold problems, integrated pest management, and the Design for the Environment labeling program is an EPA program that maybe it could be up for some debate as to how effective that is, but it's for products, and the intent is that it help to provide safer products. So these are some of your U.S. government visions. We try to work with other agencies on a lot of these programs and projects, and to serve as an example of what well-run buildings can be about, and share our success and share our challenges with others.